Today, we will be discussing one of the biggest challenges facing the world, climate change, and how it is disproportionately affecting the health of people in poverty and marginalized communities worldwide. The scope of the damage that can be inflicted by a changing climate makes it one of the most dangerous yet preventable risks to human health. And many of those whose health is most affected by climate change today and who are at most risk for the future are in communities already at risk for poor health because of poverty, neglect, and discrimination. Those with the least resources often suffer most in the aftermath of major hurricanes, drought, wildfires, and other climate related emergencies. One recent study found, on average, more than a third of heat related deaths in many parts of the world can be attributed to climate change. In some parts of Central and South America, the region I oversee programming in, it can be as high as 70%. Today, we will explore the impact of our changing climate on health and discuss solutions for health providers already seeing the effect that extreme heat, more frequent and intense storms, and increased flooding is having on their health and the health of their communities. We're going to have time for questions at the end, and you can add your questions in the Q&A box at any time. I think we're ready to kick this off. So let's meet our panel. Our first panelist is Dr. Oren Bernstein, Interim Director of the Center for Climate, Health, and Global Environment at Harvard T.H. Chan School of Public Health. The center, also known as Harvard Sea Change, increases public awareness of the health impacts of climate change and uses science to make it personal, actionable, and urgent. Dr. Bernstein, who is a pediatrician as well as an assistant professor of pediatrics at Harvard Medical School, studies the health impacts of the climate crisis on children's health and advances solutions to improve the health and well-being of children around the world. Welcome to the panel, Ari.
Great to be here.
Great. Kristen Stevens is AmeriCare's Director of Preparedness and Disaster Risk Reduction. She directs initiatives that strengthen health systems in vulnerable communities to help save lives. Her work includes implementing programs that provide safety net health centers with the tools to better prepare for future emergencies and continue to operate despite power outages, facility damage, and other obstacles. A certified emergency manager, Stevens has more than a decade of experience in health sector emergency management, including serving as Director of Emergency Management for NYU's Langone Medical Center in New York City. Welcome, Kristen. Dr. Alexis Hodges is a family nurse practitioner at the Community Care Clinic of Dare in North Carolina, which provides medical care, medication assistance, and wellness education to low-income patients without health insurance. The clinic serves 670 residents on the front lines of climate change in a community that frequently floods due to rising sea levels and severe storms. She has a doctorate in nursing and has over 30 years of experience in the medical field as a volunteer, a provider in private practice, and as a clinical associate professor of nursing for East Carolina University. Welcome, Alex.
Thank
you. Yeah, let's get started. And I think I'll kick this question to all three of you. I want to hear from all three of you on, understanding that we have a warming planet and we know this can lead to drought, extreme heat, more frequent and intense storms, even more mosquito-borne diseases. All of these can have adverse consequences to health. So in your line of work, what do you see as the biggest health risk due to climate change? Ari, why don't you kick us off?
Oh, thanks, Brenda. So climate change matters to everyone's health, and especially the health of the most vulnerable. It really spares no part of our body. And so the biggest risk to our health when it comes to climate change is if we don't meet the targets set out in the Paris Agreement. But on the flip side, in this near term, we can alleviate so much harm through acting to reduce emissions from burning fossil fuels. it's important to recognize that fossil fuels drive an astounding amount of disease burdens, both here in the United States and around the world. It's estimated that 1 in 5 deaths globally are from air pollution that's created from burning coal, gas, and oil. And in the United States, that's about 300,000 people die from fossil fuel air pollution. And you put that in the context of what we've seen from COVID-19, you realize we're losing so many lives every year, which we can prevent as we take actions to address climate change.
Thank you for that answer. And sorry, I actually got cut off because of a power outage. So, Kristen,
Yeah,
how
thanks so
about
much.
you?
This is definitely a big question, and there's a lot to unpack here. I think the thing that I think about the most is when we think about the health of patients, I'm also thinking about where they're getting their care, and I'm thinking about the health of the health centers themselves. So, what we're seeing with climate change is we're seeing increased disasters impacting local health centers, which is AmeriCare's primary constituency that we work with. We are seeing health centers sustaining physical damage. We are seeing healthcare providers working under tremendous stress due to COVID and following other kinds of disasters as well. We are seeing people moving into communities and greatly increasing the patient population. We're seeing people moving out of communities, decreasing the providers available to serve people in those communities. And so I'm thinking about it in terms of the overall resilience of the health centers themselves, the resilience of the providers in those health centers, and the ability to provide long-term sustained care.
Alex.
Agree with all of the above. Of course, I think of hurricanes a lot when I think of climate change. We've had increase in storms. It's coast of North Carolina is not unique to that. We've seen that on the Gulf Coast. We've seen it on the West Coast, et cetera, in storms. And so it's kind of a threefold measure when you think of storm impacts and that climate change. You have the hurricane evacuations, which is the first part, which for my area is very unique. There's no public transportation. So how do these patients get to safety? How do these families get to safety? The next part of that figure is we're a large fishing community. So our fishermen are moving their vessels, their boats, to safer harbors while their families are left behind to get prepared for the storm. We're also a tourist area. So the people that are working to take care of the tourists that are here until there's a mandatory evacuation are unable to prepare for the storm. So they're unable to make sure they have medicines, they make sure they have groceries, make sure they have supplies. The health impact that hits next is, of course, the actual storm itself. What happens afterwards? There's flooding. Oftentimes, there's loss of power. Loss of air conditioning with that power. So you've got that heat impact, but then you've also got the disease impact with the mosquitoes, the snakes. We also have, we don't have, our septic systems are private for each home. So when you're walking through flood water, you're walking through septic water. And so there's a major contamination and health risk there, which then leads to the next part, my third phase of the flooding and consequences of storms is what happens to homes. Homes that are flooded have mold, mildew, and those health consequences are tremendous and impact largely a respiratory illnesses such as asthma or chronic obstructive pulmonary disease.
And you certainly, among all three of you, have really highlighted all the challenges that at the various levels that we're experiencing as healthcare providers and working in this environment. But Ari, your team at Harvard is working with AmeriCare's disaster preparedness experts, such as Christine, on a groundbreaking project that will prepare healthcare providers in communities experiencing climate change to meet the health needs of those most at risk. Can you tell us a little bit about this project and why is this different from other preparedness projects? Why this hasn't been done before?
Yeah, thanks for that, Brenda. So our partnership with AmeriCares is focused on addressing what I think is one of the biggest unmet needs in terms of preparedness for climate, and that is doing preparedness in the context of frontline health clinics. When you look at the work that's been done on preparedness for climate change and health, it's almost entirely been the purview of hospitals in big cities. And we know that when disasters strike, the focus of attention shifts very quickly to the distal parts of our healthcare system, the parts that are closest to where people live, whether that's the wildfires in California, the hurricanes on the Gulf Coast, and the heat waves and floods elsewhere. We see that as communities work through these events, their needs are most often met through the clinics that serve them. And yet we have very little guidance and very little empowerment of those clinics to do more to address those needs. So that's where we're starting from. And AmeriCares has this just fantastic network of clinics that they have worked with through disasters. And we're seeing opportunities already to leverage the knowledge that is in the staff of these clinics about the people they serve to start to find ways to prevent harms that are foreseeable, just like the ones Alex was talking about when these disasters strike. So what does a patient-centered heat warning system look like, so that we're not dealing with people showing up in emergency departments and in ICUs, but we're setting up plans that reflect that individual's medical history and their access to resources like cooling centers in ways that make sense and are doable for that individual. So we're really excited about it. We think it's enormously important given the risks we're facing. And I might add that one of the potentially most powerful parts of this is that we know that the climate issue in the United States is politicized. People see it as a partisan issue. And in order to make progress, the progress that science shows we must make to protect our health, and especially to protect health equity, we have to depoliticize it. We have to make it personal. We have to make the issue actionable. And talking about health and health equity is a key part of that. We have lots of research showing that talking about climate as a health issue takes it from this realm of politics and moves it into the realm of action. And so by working with the staff at these clinics, we also enlist a group of enormously important and powerful voices for the communities they serve to speak about how climate change makes it harder to do their jobs well, to deliver the high quality care they want to deliver, and critically, as I alluded to before, that climate actions are health actions and they promote health equity. So we see really wonderful opportunities to both protect vulnerable communities that these clinics serve and to hopefully get some more voices engaged on talking about climate as a really important health issue.
You know, Ari, I couldn't agree with you more. And thinking back to Hurricane Maria, certainly what you highlight, which is how important those community health centers are in providing that first assistance and making sure that the community has all the tools to manage what's to come and what they're facing. We certainly saw that during that time here. And, you know, trying to loop that in to the work that Kristen is doing. Kristen, you know, with so many climate health or climate related health threats and challenges, how do you help these healthcare providers and these health centers prioritize?
So that's a great question. So what we do, we take a risk-based approach. So we work with the health centers to find out what are the types of hazards that they are most vulnerable to in their area. We look at it in terms of their overall preparedness to address those hazards. And then we also look at the potential impact of it. So we want to and combine that with the probability of something occurring. So we look at all four of those pieces together and help health centers rank and figure out what are the most pressing concerns. And there might be something that might be less of a probability, but have a greater risk to them if it does happen. Or there might be hazards that are frequent and people are prepared for. In the Gulf states, they experience a lot of hurricanes, for example. But we also help with that, with the prioritization. We make sure that people aren't focusing so much on the hazards that they know that they're not paying attention to other hazards outside that specific sphere. So it's an ongoing process of identifying hazards, assessing risk, reassessing risk, and making sure that providers and health centers are keeping their eye on the ball and not focused so much on what's right in front of them that they don't see what's coming up behind them.
That's fascinating, Kristen, that we don't take a cookie cutter approach, right? From what I'm hearing from you, we tailor. We work hand in hand with those centers to make sure, and with those providers to make sure that they have the right information to, as you say, prioritize and make the best decisions for their facilities and the communities that they serve. And thinking of that, Alex, yeah. No, and along those same lines, Alex, you are in the Outer Banks, and you have very particular situations, very particular experiences, especially with flooding, as you mentioned. Can you talk to us about how climate change is affecting your patients on a more personal level?
Absolutely. Again, climate change impacts with the storms, with the flooding. If you think of patients that are in housing that is limited, number one, on the Outer Banks, so to give some perspective to that, Dare County actually encompasses a little over 80 miles of land. Hatteras Island is about 65 miles of that, and that is one road in and one road out. So if transportation is already an issue and then you have road issues, patients cannot seek care at their providers. The Community Care Clinic of Dare actually has two facilities, one where I live on Hatteras Island, and then one, as I was mentioning, the 70 plus miles north of me in Nags Head. And so patients, we are only open one day a month on Hatteras Island. Patients on Hatteras Island have to figure out how to get to Nags Head. And so if they already have health disparities because of their income, housing, and then is impacted based on flooding. So Dare County is, again, it's a tourist area. So housing is very, very limited. I serve on the Dare County Board of Health and Human Services, and one of the topics at our last meeting was affordable housing for our first responders. So think about that. Our first responders have jobs. They have insurance. They have they have means for transportation, yet they cannot find housing. So our patients that meet our underserved areas here that have our health disparities, have our income disparities, they don't have access to care. So they don't have access to housing. It's a huge topic.
Yeah, no, certainly, and it makes you wonder, how do we make sure that we help these providers, these first responders, have all the tools, all the needs when we talk about their well-being. But let's shift things a little bit. I also want to pick on Ari a little bit because I try to follow all the challenges that climate change can also bring to food and water resources, food and water security, and that's sometimes a little bit overlooked. So, Ari, how can we help patients address food and water insecurities issues related to climate, this changing climate?
Yeah, it's a really important question, Brenda. It's astounding, as important as food and water are to human survival, how easily they can be overlooked. And one of the aspects of the work that we're doing with AmeriCares, and that I should definitely mention was supported and is supported by Biogen, who really saw the importance of this work to focus on climate resilience through frontline health clinics, is for the health centers to really understand these risks within the communities they serve and to work with the communities to understand where resilience may come. And a really good example of this comes from Texas. Texas, subject to hurricanes, and hurricanes can interrupt all kinds of basic services, including water, whether it's because water filtration systems fail or pipes burst or other effects. And one approach to dealing with that problem is to put, community filtered water that's in buildings that are resilient to hurricane effects. But of course, during hurricanes, people may not be able to get to those places. And so in one of the clinics in Texas, they've started a essentially community-based water filtration program where water filtration supplies, whether that's reverse osmosis or water purification tablets, are positioned in strategic points throughout neighborhoods in their communities that the people they serve know are there, so that if they have a boil water order or the water's not coming out of the spigot, they can access those resources in ways that are much more available to them than would otherwise be. So the short on food and water security is, assess now, and I think clinics in particular have a really good sense of these risks for their communities. Conserve now and prepare for later, and the prepare for later piece critically has to be informed by what is doable within the community that you're operating in.
Now, thank you for that answer. I don't know if anybody else wants to chime in on that. Kristen, I see your camera on.
Back, yeah. Thank you.
Okay. Well, I live in Puerto Rico, and I know all too well what it's like to experience back-to-back disasters that put challenges on all of those resources. We've had epidemics of mosquito-borne diseases, major hurricanes, earthquakes, massive power outages, and drought, which triggered some water rationing. And that's just alone in the past 5 to 6 years. So all these compounded traumatic events can have a detrimental effect on the mental health and well-being of people living in these affected communities, and certainly the healthcare workers. So Kristen, how does AmeriCares help healthcare workers in disaster-prone communities prepare for these emergencies?
It's such an important question. At AmeriCares, we have robust mental health programming in general. Those of you who've been with us this afternoon heard about some of that. But one of the most exciting things that we've been doing in the last year is bringing together our mental health and preparedness work into an integrated program. Because we know that on the preparedness side, it's not enough to have emergency plans in place and have a backup generator and all of that. If the healthcare workers aren't in a good position personally to be able to respond. So we are living through incredibly stressful times. And for many of the healthcare workers that we work with, day-to-day work is stressful, right? They work with people who have tremendous needs, often resource-poor environments. It can be very stressful work. Now compound that with a disaster. So what we try to do is figure out, how do we marry those things together? So you can have the best plan in the world, but if you're not personally equipped to carry it out, right? And if your staff doesn't have the wherewithal to continue to care for themselves and care for each other, they're not going to be able to care for their patients. So it's a really exciting development that we've piloted this past year in California, and we are looking forward to rolling that out on a more wider basis.
That's fascinating. Thanks for sharing that. And Alex, speaking of mental health, earlier you kind of touched on some added issues about stress disasters and how they, that places additional stress on your patients. Can you talk about how you address the mental health impacts for your patients?
Absolutely. And kind of to give you a little bit more background about the patients, A prime example can be during a hurricane, post-hurricane, I should say, on the island, you will have patients that, again, cannot access care. So we providers will go directly to the house. We've called the pharmacies out to get prescriptions, et cetera. And one of the biggest issues that we really try diligently at the community care clinic is to make sure our patients are prepared as much as possible to have the prescriptions and the medications that they need and know where the support systems are prior to an event. So let's talk about an event. It's kind of like post-traumatic stress disorder. People who live in hurricane-prone areas probably can agree with me. Probably 98% of the population goes into planning mode as soon as we start hurricane season. We're checking the weather app. We're checking to see when a storm's coming. We're preparing. We're monitoring the weather. We're stockpiling. But again, what happens when you don't have access to care? Because you can't find a physician, you can't find a provider. Again, going back to the area, and I hate to blame COVID, but COVID has caused people to relocate to secondary homes. And so you've had an influx of the population. So Dare County has a population year round about 37,000. And in the summertime, we swell to over 300,000. There's not enough healthcare providers for that on a normal day. And then you add some of those families coming back in and living. So there's not enough providers to go around. You may be traveling the 70 miles to seek access to care. And mental health is even more thin lined as far as the number of providers. We are extremely deficient in that area, I think nationwide. I think if you spoke to any primary care provider, they would say they are routinely managing diseases that we normally would have had the psychiatrist see. We're not just talking depression, we're talking depression, anxiety, suicidal ideations, etc. So mental health is huge, and we on the forefront are meeting that challenge. We meet the challenge in our clinic with utilization of our resources. And again, you may be limited, but you kind of do with what you can. Just a couple weeks ago, I had a patient who's living in a literally one room with a bathroom, no kitchen, with her 4 children. So you have major health disparities for food, for water, for medications. Who's helping her and her mental health, but who's helping care for the children that are age 3 to 13? And she's by herself and she's having to go work the 12-hour shifts. So we really are trying to be very proactive. We gave that patient numerous resources, even went the extra mile of contacting legal aid for her for her citizenship, et cetera. So I think it's important that we encompass the entire patient. It's one of the things I teach my students. We always want to drive home that you're doing the complete history and physical. Well, oftentimes mental illness or even I shouldn't say mental illness, just the psychiatric wellness screening is what I like to call it. Everyone needs that psychiatric wellness screening. Are you depressed? What situation, what can we do to help? And so on the forefront, we need to be proactive rather than reactive.
No, certainly, Alex, and it's important to, as you say, look at the patient holistically, right? It's not just absence of disease; it's the entire patient, their mental well-being, and making sure that they have the resources needed in order to continue forth. And again, talking about adequate resources, and earlier in the week, Ari, when we were getting together to discuss what topics we might be interested in touching upon for this panel, you mentioned the precisely not having adequate resources in Massachusetts, where you're at, for the enormous influx of people displaced from Puerto Rico right after Hurricane Maria. So again, what can we do, taking that into consideration, and also what Alex just shared with us? What else can we do to make sure that we don't task our already stretched thin resources?
Well, Brenda, I think that's a great case and point for one of the rationales of our work with AmeriCares, which is to empower the voices of folks working on the front lines so that their voices are heard for the communities they serve in policymaking decisions. I think we absolutely need to do more to make sure that we're prepared for people being displaced, whether that's within states or even within towns, or as the case of Maria and Puerto Rico makes so clear, from an island into the mainland of the United States. So I think it really is an issue that deserves more attention. I think our work with AmeriCares is a great example of how we can elevate voices that aren't heard enough in how we think about preparedness around climate. And I'm hopeful that it's a part of a broader wave that we're seeing that will make us much better prepared for what's already happening and what we can see coming down the road.
Yeah. And, again, trying to tie all connect all the dots. Kristen, how do we then take that that idea and choose from AmeriCare's perspective, right? How do we go ahead and decide with which clinics we think we need to work? What helps us as an organization prioritize?
Yeah, that's a great question. It's we look at a number of different things. So one of the things that we know is that no one is immune from the impacts of climate change. So we're not just targeting specific health centers up front, but we are looking with areas where we have strong partnerships. One of the really exciting things about this program is that it brings together the academics of Harvard with the operational experience of AmeriCares with the health centers who are doing the real work on the ground. And so it's a real opportunity for us to basically translate the work that is coming out of Harvard, work with the health centers to turn it into something that works for them, right? So we're building tools that are customizable to the local context, that we can adapt as needed. And so when we're looking for partners, we're looking for people who are excited about this, and we're looking for people who recognize the need. We're starting off with 9 pilot health centers. They've all been very interested and engaged, and then we're looking to roll out from there. This is something that we know that affects everybody. Pre-COVID times, we would do what we called our preparedness boot camps. And we always concluded them with a tabletop exercise where health centers would work through a simulation, and they would take everything they learned in the boot camp and try to apply it in a real scenario. And some of the pushback that we had frequently gotten is that the health centers would say, well, we don't have disasters here. Outside of places that were in specific hurricane zones, they would say, we're not really impacted by disasters here. But they thought that this was sort of a good thing to do, so they would do the program. So our tabletop exercise was always a pandemic, because we would always say, we can all be impacted by a pandemic. And so, of course, it's terrible that we were right about that. But I think it also gives some credence to the notion that, we're thinking bigger and broader than we're trying to look much further down the road, right? So many of the health centers, we've talked about the resource restrictions and challenges and so forth. So many of the health centers we work with are trying to solve immediate problems. And what we're able to do in our partnership with Harvard is look further down the road and say, this is what's coming, and let's get you ready for it now. You're experiencing now, this is what's coming further down the road. We are starting with health centers that have expressed an interest in it, and we will be recruiting widely for it. But our goal is to get this out to as many health centers as we can, because it is going to impact all of us now and well into the future.
Thank you for that. And Alex, bringing it home, right, for the healthcare centers, what are the things that you as a provider at one of these very critical community-centered facilities, what would you like to see from us?
Again, I think we're doing it. We're being proactive instead of reactive. And again, being policy change makers. I preach that to my students that we can be the change agent. We try to do something positive for each patient and figure out what it is those patients need. And again, like Kristen said, let's be proactive. No one would ever thought we would be in the pandemic that we're in, but yes, disasters happen. Um, they happen whether you think of them as a true disaster or not. A house fire can be a disaster, and it is. Living in Eastern North Carolina too, we have a lot of migrant farmers, migrant fishermen. So bringing in that health disparities, bringing in equity for healthcare. For me, my translator on my clinic days is I can't function without her. And that's huge that we have that access to care for those patients. We're being proactive. We're making sure we're getting the vaccines out there. We are doing the medication assistance programs. And I think kind of wrapping it up, bringing it back home to Dare County. What you may not be aware of is some new regulations with flood zones and FEMA. And the regulations that are in our legislature right now will prohibit the average person from ever building a home or owning a home in Dare County. And to me, that is extremely sad. My patients that I'm seeing, they have no hope for owning a home because they're not going to be able to afford flood insurance. And so again, being that change agent and bringing the whole patient into the picture, every aspect.
No, certainly. So, a lot of things that we have discussed here today, important topics that, and you've helped us tied in all the little pieces about adequate resourcing, policy making decisions, holistic view of the patient, integrated programming. Um, Stepping aside from cookie cutter approach and actually listening to individuals, listening to the centers. What is it that they need? What is it that they would like to see? And that the immediate that these are things that are not happening in some exotic places. We're not talking about Vanuatu or anything like that. We're talking about right here and now in our own backyards. We're seeing these effects. So before we leave, any parting thoughts from all of you? Ari, let's start with you.
I'm really encouraged by the conversation here, and I hope those who are watching also have felt some sense of a path forward in what can otherwise seem a really difficult set of circumstances. But it's really a testament to AmeriCare's leadership and the work they've done to really think further upstream and really focus on the unique risks that climate poses to the very mission of the organization, as not to mention all the folks in the communities that are served in the clinics on the front lines. And so I'm very excited about this work. I hope we can really advance what I think are some worthy goals for protecting the health of vulnerable people in the United States.
Thank you. Alex?
I'll just echo Ari. Pleasure to be here and feel revitalized that we can be the change agent. We can make healthcare equitable and make it that there are no disparities one day for our children's future.
Well said. And Kristen?
These are challenging times and these are challenging threats that we face, but I feel hopeful. And for me, one of the things I feel most hopeful about, and I think one of our greatest chances of success is the kinds of partnerships that we're building here. Different organizations, different people have different missions and bring different skill sets to the table. And I think that our partnership on this is one great example of it. We have shown there have certainly been some challenges globally in the pandemic, but we've also seen so much of what positive things can happen when different organizations and people pull together to try and find a common solution. So that's what I'm looking for and calling for, and for people who are listening, find out who you can partner with. Where are the force multipliers, right? How can you bring different organizations together and come out with something that is stronger than either of them alone? So we are looking to partner together, and Bob will join us.
Um, Thank you. And what a way to bring it home, Kristen. Certainly, this call to action, partner, figure out who you can partner with. If we fit the bill, partner with us. As you can see, we have great partnerships going on with Sea Change, Harvest Sea Change, and our work has impact at the community level. So I thank everyone for being here today with us. I thank this amazing panel that has made my job easier at moderating and navigating all these questions. And again, thanks for joining us. And AmeriCares, like we like to say, health is on the way.